Diseased liver, symptoms, warning signs, and essential prevention. Hello, and welcome to this space dedicated to your health. Today, we're going to talk about a vital organ that often goes unnoticed until it starts to fail, the liver. This organ, located just beneath the rib cage on the upper right side of the abdomen, is absolutely crucial to our life. It weighs approximately 1.8 kilograms and is responsible for essential functions: detoxifying the body, producing proteins, regulating metabolism, and digesting food. But here's the problem: liver diseases are often silent in their early stages. By the time symptoms appear, the damage may already be significant. That's why today, I want to help you identify the early signs that something might be wrong. Early symptoms of liver disease. The first signs can be very subtle. They may not be felt or seen and are often mistaken for other common ailments. Pay close attention if you experience any of these symptoms persistently. Constant fatigue and weakness. Feeling exhausted even after proper rest may indicate that your liver isn't functioning as it should, impacting your energy and overall well-being. General discomfort and frequent nausea. A sense of queasiness or nausea, especially after meals, can be linked to impaired digestion due to liver dysfunction. Loss of appetite. If you find yourself consistently uninterested in eating, particularly fatty foods, this could signal the early stages of liver disease. Pain or discomfort in the upper right abdomen. The liver doesn't have pain receptors, but its inflammation or enlargement can create a sensation of heaviness or pain that may radiate to the back. Itchy skin. Persistent and unexplained itching may be due to bile salts accumulating in the skin. Changes in urine and stool color. Urine may become unusually dark, like the color of tea, while stools may appear pale, grayish, or clay-colored. This indicates that bilirubin is not being excreted properly. Advanced liver disease and cirrhosis symptoms. As liver disease progresses, particularly towards cirrhosis, severe and irreversible scarring, the symptoms become more noticeable and require immediate medical attention. Cirrhosis can lead to end-stage liver failure, a life-threatening condition. Jaundice. One of the most visible signs: yellowing of the skin and the whites of the eyes. This occurs due to excess bilirubin in the blood. Abdominal swelling, ascites. Fluid builds up in the abdomen, causing bloating. This can interfere with eating and breathing and may become infected, leading to spontaneous bacterial peritonitis. Swelling in the legs and ankles. Fluid retention may also occur in the lower limbs. Mental confusion or personality changes. When the liver fails to filter toxins, they can reach the brain, causing hepatic encephalopathy. Symptoms include confusion, drowsiness, slurred speech, and personality changes. It is often reversible with timely treatment. Easy bruising and bleeding. A diseased liver struggles to produce clotting factors, leading to frequent bruising, nosebleeds, gum bleeding, or petechiae eye. Dilated veins. Spider angiomas may appear on the upper body, and prominent veins around the belly button, caput medusae, can indicate portal hypertension. Dilated esophageal veins may also develop, which can rupture and bleed severely. Red palms. Palmar erythema, or redness in the palms, is another common sign. Enlarged spleen. Often associated with portal hypertension, which increases blood pressure in the portal vein system. Sweet or musty breath odor. Known as Phaeter hepaticus, this is caused by the buildup of substances that are not properly eliminated. Malnutrition and muscle wasting. Advanced liver disease often leads to poor nutrient absorption, resulting in weight loss and reduced muscle mass. Hormonal changes. In men, testicular atrophy, reduced libido, and gynecomastia may occur. Women may experience menstrual irregularities or amenorrhea. Non-alcoholic fatty liver disease, NAFLD, symptoms. Non-alcoholic fatty liver disease is currently the most common liver disease worldwide, especially in Western countries. It is strongly associated with obesity and metabolic syndrome. In its early stages, it is asymptomatic. However, when it progresses to non-alcoholic steatohepatitis, NASH, a more serious condition with inflammation and damage, symptoms similar to those of cirrhosis may appear. Constant fatigue. General discomfort. Heaviness or pain in the right upper abdomen. Anxiety. Rejection of fatty foods. Fat accumulation around the abdominal area. When to see a doctor. Because symptoms often appear late and may be non-specific, it's important to act as soon as you have any concerns. Seek medical attention if you experience persistent fatigue, nausea, itching, or abdominal discomfort. You notice changes in the color of your urine or stools. You have risk factors such as obesity, diabetes, high cholesterol, high blood pressure, or alcohol consumption. You are taking medications that may affect the liver. If you experience serious symptoms like jaundice, intense abdominal pain, mental confusion, or unusual bleeding, seek emergency care. Doctors usually diagnose liver disease through non-invasive methods, ultrasounds, CT scans, MRIs, and blood tests. These tests evaluate liver enzymes, ALT, AST, bilirubin, albumin, and prothrombin time to assess liver function and detect damage. Liver care and prevention. The good news is that many liver diseases can be prevented or their progression can be significantly slowed. Here's how to protect your liver. Avoid excessive alcohol consumption. Alcoholic cirrhosis is a leading cause of liver failure. It is recommended not to exceed 1 drink per day for women and 2 for men. Maintain a healthy weight. Obesity and type 2 diabetes are strongly linked to fatty liver disease. Exercise regularly. It helps burn fat and improves liver function. Be cautious with medications and supplements. Overuse of painkillers such as acetaminophen or some natural supplements can be toxic to the liver. Practice safe sex and avoid sharing needles. Hepatitis B and C are transmitted through blood and bodily fluids and can severely damage the liver. Hepatitis B is preventable through vaccination. Manage chronic conditions. If you have a known liver condition, regular medical checkups are essential to prevent further damage. Final thoughts. A healthy liver is a key to a full and vibrant life. Listening to your body and recognizing these warning signs is the first step toward protecting this vital organ. Do not underestimate these symptoms, no matter how vague they may seem. Early detection can make a tremendous difference in your prognosis and quality of life. Take care of your liver, take care of your life. And if you have any concerns, do not hesitate to consult a healthcare professional.